It's just anxiety. Have you tried losing weight? You're too young to have that much pain. Your test came back normal, so there's nothing wrong with you. Just relax more. Are you sure it's not in your head? If you heard any of these phrases from a doctor while you're suffering with real physical symptoms, you've experienced medical gaslighting. And you're not alone. You're not crazy. You're not making it up. You're being systematically dismissed by a medical system that doesn't know how to handle what it can't easily see or measure. Today, we're exposing medical gaslighting, what it is, why it happens, who it affects most, and why it's causing actual trauma, delayed diagnoses, and deaths. This episode is for everyone who's ever walked out of a doctor's office feeling unheard, dismissed, or like they're losing their mind. Because you're not. The system is gaslighting you, and it's time we named it. Welcome back to Painfully Real. Today we're talking about something that's gone viral on social media, but is barely acknowledged by the medical establishment, medical gaslight. If you've never heard the term, you're about to have a aha moment. If you've heard it, you're about to feel deeply seen and validated. So let's dive in. Let's start with a definition. Medical gaslighting is when a patient's health concerns are not given appropriate medical evaluation and are instead downplayed, misattributed, or dismissed outright. It's when doctors tell you your symptoms aren't real or aren't as bad as you say, attribute physical symptoms to psychological causes without investigating. They dismiss your lived experience of your own body, make you doubt your own reality about your symptoms. Gaslighting is defined as behaviors inflicted on an individual which invalidate or call into question their ability to judge their own lived experience. The term gaslighting comes from a 1938 play and later a 1944 film called Gaslight, where a husband manipulates his wife into thinking she's going insane by dimming the gas lights in their home and then denying it's happening. That's what medical gaslighting feels like. You know something is wrong with your body, you're experiencing real symptoms, but your doctor is telling you it's not real, not that bad, or it's all in your head. And when an authority figure, someone with power, education, and societal trust tells you your reality isn't real, you start to doubt yourself. So here's what medical gaslighting looks like, because it shows up in many different forms. Well, your tests are normal, so nothing's wrong. And this is perhaps the most common form. Just because current testing doesn't show an abnormality doesn't mean you're not sick. It means we don't have the right test yet, or we're looking in the wrong place, or your condition isn't detectable with current technology. And many chronic conditions, fibromyalgia, ME, migraines, and many autoimmune diseases in early stages don't show up on standard testing. It's just stress, anxiety, depression. Physical symptoms get attributed to mental health without proper investigation. And this is especially common for women and anyone with mental health history. Yes, anxiety can cause physical symptoms, but that doesn't mean every physical symptom is anxiety. And dismissing symptoms as psychological prevents finding actual physical causes. You're too young, old, thin, active to have that condition. Doctors make assumptions based on demographics instead of listening to the individual patient in front of them. Pain doesn't care about your age. Disease doesn't care about your weight. And illness doesn't care if you look healthy. Everyone feels tired, sore, or stressed. So minimizing and normalizing your symptoms, making you feel like you're weak or complaining about normal human experiences. Now, there's a difference between normal fatigue and chronic fatigue syndrome, between normal soreness and chronic pain, between normal stress and debilitating symptoms. Have you tried Tylenol or yoga or meditation or losing weight, essential oils, positive thinking? Suggesting simplistic solutions for complex problems, implying you just haven't tried hard enough. Now, of course, chronic pain patients have tried basic interventions. We've tried pretty much everything. That's why we're at the doctor. Or the classic, let's just wait and watch and wait. Delaying investigation or treatment with no clear plan. Sometimes watch and wait is appropriate, but often it's code for, I don't know what's wrong and I'm hoping it goes away so I don't have to deal with it. Meanwhile, conditions worsen. Windows for effective treatment close. Patients suffer unnecessarily. You see, the impact of medical gaslighting is profound. With ME, for example, patients with ME For example, wait an average of 14 years for a diagnosis, 14 years of suffering, being told it's not real, of having their lives fall apart while they search for answers. 55% of patients experiencing medical gaslighting consider giving up on seeking care entirely. Now, that's over half of patients who are so traumatized by dismissal that they consider just giving up, living with untreated illness because the medical system has broken them. Among survey participants, 55% reported worsened symptoms after a doctor didn't respond to their concerns, with another 28% experiencing a health emergency because of it. Medical gaslighting doesn't just hurt feelings, it causes actual medical harm, delayed diagnoses, worsened conditions, preventable complications, sometimes even death. Some doctors push back against the term gaslighting, saying it's too accusatory, that it implies intentional manipulation. But here's the thing, gaslighting doesn't have to be intentional or be harmful. Whether a doctor is deliberately dismissing you or unconsciously doing so because of bias, lack of training, or systemic pressures, the effect on you is the same. You're made to doubt your own reality. You're made to feel crazy. You're denied appropriate care. And intent doesn't matter when the harm is identical. Let me give you some numbers that will make your blood boil. Women bear the brunt. A 2024 study of patients with vulvovaginal pain found that 45% were told they just needed to relax more, and 39% were made to feel that they were crazy. Think about that. Nearly half of women with real physical pain condition were told to relax, as if pain is a personality problem, not a medical condition. See, women are twice as likely as men to be diagnosed with mental illness when their symptoms were meant to elicit a heart disease diagnosis. Same symptoms, different gender, different diagnoses. That's not medicine. It's bias. Women are more likely to have their pain described as emotional or psychogenic than men, even when presenting with identical symptoms. A January 2025 report from the National Academies found that research on diseases disproportionately affecting women were underfunded compared with diseases disproportionately affecting men. So women get sick with conditions that are under-researched, then get dismissed when they seek help for those conditions. It's a perfect storm of medical neglect. The historical roots, now, this didn't start recently. Medical gaslighting is rooted in centuries of gender bias in medicine, with women's reproductive health issues long being dismissed as psychological or hysterical. The word hysteria, comes from the Greek word for uterus. For centuries, any symptom a woman reported was attributed to her uterus, making her emotionally unstable. A century ago, Freudian psychoanalysts incorrectly believed that female sexual pain came from psychological complexes like penis envy. These aren't ancient history. These beliefs still influence how doctors are trained and how they practice today. An analysis of 20 years of research from the U.S. showed that Black patients with pain were 22% less likely to receive pain medication from their doctors. Same pain, different race, different treatment. Black and Hispanic adults, women, low-income households, and uninsured adults particularly face barriers in accessibility and experience systemic discrimination in pain care. Women reporting chronic pain are frequently perceived as overly emotional, resulting in their symptoms being attributed to psychiatric causes at a much higher rate than men. See, medical gaslighting is an equal opportunity. It targets the most vulnerable, women, people of color, LGBTQ plus individuals, people with mental health histories, people with disabilities. A Health Central survey of chronic illness patients found staggering results. 55% reported worsened symptoms after a doctor didn't respond to their concerns, with 28% experiencing a health emergency because of medical dismissal. One respondent wrote, "I was refused treatment because I am young and cannot possibly be in pain. After 3 years of severe, disabling pain, I got a doctor to do proper imaging after begging to be listened to. The imaging showed severe osteoarthritis and degeneration of the discs. 3 years. 3 years of suffering that could have been treated sooner if the doctor had just believed them." Another survey participant reported being dismissed, disbelieved, mocked, called names, condescended, treated like a child, not listened to, and maltreated. Now, that's not healthcare. That's abuse. The pelvic pain data that I presented, patients with vulvovaginal pain see an average of 5.7 providers before getting an accurate diagnosis or treatment. Almost 6 doctors before someone finally helps you. Imagine the time, money, emotional energy, and suffering involved in seeing 6 different providers who all dismiss you. 42% felt unsupported, 27% were belittled, and 21% felt outright disbelieved by their healthcare providers. 45% were told to just relax, implying their pain was stress related rather than a legitimate medical condition. You see, 55% considered giving up on seeking care because they felt their concerns were not being addressed. Another 39% reported feeling crazy due to being dismissed by a medical provider. And these aren't isolated incidences. This is systemic. This is the norm for many chronic illness patients, especially women. And the mental health impact is huge because up to 85% of chronic pain sufferers also experience depression. But here's the question. Is the pain causing depression, or is the constant medical dismissal and gaslighting causing depression? Or could it be both? You see, the cycle of gaslighting compounds the burden of pain and might lead to long-term psychological effects like anxiety, depression, and PTSD symptoms. Research shows that repeated negative encounters with healthcare providers can cause clinical association trauma comparable to PTSD. And medical gaslighting causes actual psychiatric trauma. And then that trauma is used as evidence that it was anxiety all along. It's a vicious, self-fulfilling cycle. Medical gaslighting isn't usually intentional malice. It's a complex systemic problem with multiple contributing factors. One major contributing factor is lack of provider training on pelvic pain or any form of pelvic floor dysfunction, with most providers ignoring the pelvic floor entirely. This applies to many conditions: chronic pain, chronic fatigue, autoimmune diseases, functional disorders. If doctors aren't trained to recognize and treat these conditions, they don't know what to do when patients present with them. And when doctors don't know what they do, they often blame the patients instead of admitting their own knowledge gap. Here's the if I can see it, it's not real problem, because there is no way to visualize and objectively measure pain. Many patients have experienced their pain being questioned, dismissed, or downplayed by healthcare professionals. Modern medicine is built on objective testing, blood work, imaging, biopsies. If the test is normal, many doctors assume nothing is wrong. But absence of evidence isn't evidence of absence. Let's repeat that. Absence of evidence isn't evidence of absence. Just because we can't see something doesn't mean it doesn't exist. Many legitimate medical conditions don't show up on standard testing, especially in early stages or with current technology limitations. When pain doesn't just have an obvious cause, providers may be more likely to question the patient's credibility instead of investigating further. This is called epistemic injustice, the tendency to discredit someone's lived experience, especially when they're from a marginalized group or have a condition the doctor doesn't understand. The patient is the expert on their own body and symptoms. But medical training teaches doctors they're the authority, and patient testimony is secondary to test results. This power imbalance enables gaslight. Implicit bias may be a contributing factor, with some demographics not fitting the traditional experience of pain, which is based largely on white males. Medical research has historically been conducted primarily on white men. Symptoms that present differently in women or people of color are seen as atypical or exaggerated. Doctors are trained on male bodies as the default. Everything else is seen as deviation. This isn't conscious prejudice in most cases. It's unconscious bias shaped by systemic problems in medical research and education. But unconscious or not, the harm is real. Now, conditions like fibromyalgia, IBS, chronic fatigue syndrome, migraines, these are often labeled functional disorders. Functional is a medical code for we don't know what causes it and can't find structural damage. But functional disorder has become synonymous with not real or psychological in many doctors' minds. GI conditions that fall under disorders of gut-brain interaction are more likely to be stigmatized than those with a clear, organic etiology. If a condition doesn't fit the biomedical model of visible damage and clear etiology, it's dismissed as less legitimate. And I get it, physicians get burned out. And symptoms of burnout affect over half of physicians in active practice, with approximately 29% having clinically significant depressive symptoms, 24% generalized anxiety, and 4 to 16% PTSD. Burnout, depressed, anxious doctors don't have the emotional bandwidth to sit with complex, difficult to treat patients. They're overwhelmed by the system. They have 15-minute appointment slots. They're pressured to see more patients, code correctly, satisfy insurance companies, avoid lawsuits. Complex chronic illness patients are time consuming and don't fit neat diagnostic boxes. So some doctors dismiss them because they don't have the resources to help them properly. And this doesn't excuse gaslighting, but it helps explain why it's so widespread. In 2023, there were at least 8 key and often competing stakeholders in U.S. healthcare: patients, providers, hospitals, healthcare systems, payers, insurance, employers, government, billing, clearinghouses, and pharmacy benefit managers. See, doctors aren't just treating patients, they're navigating insurance requirements, hospital policies, government regulations, billing codes, legal liability. All of these competing pressures create an environment where dismissing complex patients is easier than advocating for them. And your healthcare access crisis is an issue because only 9% of the country's physicians work in rural communities, despite 20% of the US population living there. Limited access means longer wait times, rushed appointments, and providers who are overwhelmed. When you finally get an appointment after waiting months and the doctor dismisses you in 10 minutes, that's partially a resource problem, not just an individual doctor problem. The system is broken, and medical gaslighting is one of the symptoms. So let's talk about what medical gaslighting actually does to patients. Like ME patients, they wait an average of 14 years for a diagnosis. Inappropriate treatments can exacerbate symptoms, sometimes irreversibly. 14 years of suffering that could be managed. 14 years of declining health. 14 years of being told you're fine when you're not. And during those 14 years, conditions worsen and become harder to treat. Preventable complications develop. Your quality of life deteriorates and your relationships suffer. You lose your careers and financial security evaporates. And it's all because doctors dismiss the symptoms instead of investigating. You see, when doctors attribute physical symptoms to psychological causes, patients get the wrong treatment. They're given antidepressants when they need antibiotics. They're therapy when they need surgery. Meditation apps when they need medical intervention. And while they're receiving inappropriate treatment, the real condition continues untreated, often getting worse. Gaslighting fosters self-doubt, anxiety, depression, and even PTSD, with repeated dismissals leading to clinician-associated trauma. Medical gaslighting causes actual trauma. You develop fear of going to doctors, anxiety before and during appointments, hypervigilant about how you present symptoms, performance anxiety about being sick enough to be believed, depression from chronic invalidation, self-doubt about your own experiences. One patient wrote, "I have left more than one doctor's office to sit in my car and cry because they made me feel so badly about myself over my chronic health issues." You see, that's trauma, that's harm, and it's caused by the system that's supposed to help. I mean, how many stories have we read about veterans walking out of a VA clinic with not getting the help that they need and taking their own lives? This falls into that category. The repeated experience of being dismissed by clinicians erodes patients' sense of trust in the healthcare system, making them hesitant to seek medical attention in the future, fearing they will once again be dismissed. When the place you're supposed to go for help consistently harms you, you stop going. You delay care. You avoid doctors. You try to manage everything yourself. Yet sometimes that costs you your life. When untreated conditions worsen, treatable problems become chronic. Manageable issues become disabling. Your patients lose function, independence, and quality of life, not because their conditions are untreatable, but because they were dismissed instead of being treated. Did you know that more than 75% of chronic pain patients were unable to pursue certain treatments because of financial constraints? With chronic pain patients facing annual medical costs nearly $8,000 higher than pain-free individuals. That's crazy. And that's for patients who are getting treatment. For patients being gaslighted, the costs multiply because now you're seeing multiple doctors seeking answers. You're paying for appointments that go nowhere. trying various treatments that don't work because they're treating the wrong thing. You're losing wages from untreated illnesses, and sometimes you're losing your jobs entirely. 74% of individuals suffering from high-impact chronic pain are unemployed, which significantly impedes their capacity to cover necessary medical care costs. When you're told your symptoms aren't real, your support system starts to doubt you. Family members echo what doctors say. Maybe it's just stress. The doctor said you're fine. Are you sure you're just not anxious? Friends stop inviting you places because you always cancel anyway. Always cancel anyway. Your partner gets frustrated that you're still seeking answers after doctors have said nothing's wrong. Medical gaslighting doesn't just harm your relationship with healthcare, it damages every relationship in your life. And while systemic change is necessary, here are practical strategies to protect yourself from medical gaslighting now. You've got to trust your own experience. This is the first and most important. If you're experiencing symptoms, they're real and full stop. You don't need a doctor's validation to believe yourself. You live in your body 24/7. You're the expert on your own experience. A doctor who doesn't believe isn't saying something true about you. They're revealing their own limitations. Document everything. Keeping detailed records of symptoms, including patterns and triggers, can help advocate for thorough evaluation. Keep a symptom journal. Dates, times, severity, triggers, what helps and what doesn't, and bring this to your appointments. Because your documentation does two things. Helps doctors see patterns they might miss in a brief appointment. Makes it harder for them to dismiss you as just anxious when you have detailed organized data. Bring support, because having another person in the room changes dynamics. Doctors are less likely to be dismissive when there's a witness. Your advocate can take notes while you focus on communicating. Ask questions you forgot to ask. Validate your experience afterward. And they can witness inappropriate behavior. You've got to start using specific language. So instead of, I'm tired all the time, say, I sleep 10 hours and wake up feeling like I didn't sleep at all. I can't work past 2 p.m. without needing to lie down. Instead of, I hurt, say, sharp, stabbing pain in my right shoulder that radiates down my arm, rates 7 to 8 out of 10. Worse with movement, present for about 6 months now, because specific detailed descriptions are harder to dismiss than vague complaints. Start asking direct questions. What else could be causing these symptoms? What would you do if this were your family member? Can you explain why you think this is anxiety when I've never had anxiety before these physical symptoms appeared? What's your plan to investigate this if the first treatment doesn't work? Direct questions force doctors to engage with your concerns instead of brushing them off. Request tests and referrals in writing. If a doctor refuses to order tests or refer you to a specialist, ask him to document it in your chart why they're refusing. Often, the act of having to officially document their refusal makes doctors reconsider. And if they still refuse, you have written evidence if you need to file a complaint or see another provider. You have to know when to walk away, because not every doctor can be convinced. Not every provider is a good fit. If a doctor consistently dismisses you, belittles you, or makes you feel worse, you have permission to fire them and find someone else, because you deserve a provider who listens, believes you, and partners with you in finding answers. Find specialists and informed providers, because generalists may not recognize complex conditions. Seek out specialists in your specific type of symptom. Look for providers who have experience with complex chronic conditions. Come recommended by patient advocacy groups. Practice trauma-informed care. Explicitly state they believe in conditions like fibromyalgia, CRPS, ME, CFS, etc. Connect with patient communities. I know there are several of them on Facebook. There's the school communities. I'm working on starting up one myself, Painfully Real Academy. Join it. We can talk about a lot of stuff and help each other. Because at the end of the day, online communities for your condition can provide recommendations for good doctors, warnings about dismissive providers, validation that you're not alone, strategies that have worked for others, emotional support during the journey, because you shouldn't have to navigate this alone. Individual strategies help, but we need systemic change. We need a medical education reform, clinician education, especially about complex chronic conditions, is beneficial not only for the clinician's relationship with the patient, but can also alleviate some of the burden and overwhelming feelings clinicians have when treating patients with chronic and or rare illnesses. Medical schools and residency programs need to teach about implicit bias and how it affects care. Include education on chronic pain, functional disorders, and complex illnesses. Train doctors to say, I don't know, and refer appropriately. Emphasize listening to patients as a diagnostic tool and address the historical roots of medical sexism and racism. We need equal research funding for conditions affecting women, studies that include diverse population, research into conditions that lack objective diagnostic markers, investigation of treatments beyond pharmaceuticals. Patients need ways to report medical gaslighting and have it taken seriously. Medical boards should investigate patterns of dismissive care. Hospitals should track patient satisfaction related to feeling heard and believed. There should be consequences for providers who repeatedly gaslight patients. There needs to be a complete healthcare system reform. With at least 8 competing stakeholders in U.S. healthcare, doctors face enormous pressures that contributes to dismissive care. We need longer appointment times for complex patients, better insurance coverage for thorough evaluation, reduction of administrative burdens on physicians. We've got to support physician mental health and systems that prioritize patients' care over profit. Now, if you've ever experienced medical gaslighting, if you've been dismissed, doubted, or made to feel crazy, I want you to know something. That trauma is real and you don't have to carry it alone. In my coaching program, I work with chronic pain and chronic illness patients who are healing from medical gaslighting and learning to advocate effectively within a broken system. We'll work on processing the trauma of being dismissed and rebuilding self-trust, in developing advocacy skills to be heard by dismissive providers, preparing for appointments strategically to maximize your chances of appropriate care, building confidence in your own experience after it's been invalidated. We'll work on finding providers who practice trauma-informed care and creating documentation that protects you and validates your experience, and healing the psychological damage medical gaslighting causes. Because you deserve to be believed. You deserve appropriate care. You deserve a provider who sees you as a partner, not a problem. Head over to my school community, Painfully Real Academy. Check it out. Join. It's free. There are some other avenues in there for training and ways to navigate working with chronic pain. And let's talk about your experiences and how I can help you navigate this system while protecting your mental health and dignity. Because medical gaslighting is real. It's widespread. It's harmful. And it's not your fault because you're not crazy. You're not making it up. You're not exaggerating. But you're experiencing real symptoms that deserve real investigation and real treatment. And when doctors dismiss you, that says everything about the limitations of the medical system and nothing about the validity of your experience. Medical gaslighting is a complex systemic problem fueled by holes in medical research and training. It's not just individual bad doctors, though those do exist. It's a system that enables and sometimes encourages dismissal of complex patients. But that doesn't mean you're powerless. You can advocate for yourself. You can find better providers. You can document your experiences. You can build support networks. And you can speak up about medical gaslighting. Share your stories. Make noise. Demand change. Because the more we talk about this, the harder it becomes for the medical establishment to ignore. You are not alone in this. Millions of patients have experienced exactly what you're experiencing. And together, we can demand better. Thank you for listening to this episode of Painfully Real. If this episode validated your experience, please share it. Tag a friend who needs to hear this. Comment with your medical gaslighting story. Let's make this issue impossible to ignore. And remember, you know your body. You know your experience. Trust yourself. And I'll see you next time.